What every long-term health care benefit policyholder needs to know about filing a claim in a Parkinson's disease case. This is part 3 of our multi-part series on dealing with a long-term health care claim where the long-term health care policyholder or a loved one who has a policy has PD. PD is a progressive disease, and you may start out with a diagnosis and not particularly have any difficulties with activity of daily living. Unfortunately, as the disease progresses, a person's need for care will normally increase and certainly increase over time. We've talked about what you need to be looking at potentially in terms of the policy, and we've talked about the medical records, the symptoms, the functionality, the care plan. Let's talk about the games that a carrier can play in a Parkinson's claim. Now, as I've said before, they're not necessarily in the business of paying the benefits they promised to, either paying them, paying the correct amount, paying the facility that your loved one or you might be in, and they're looking for all sorts of reasons to deny an otherwise legitimate claim. Let's talk about the reasons why a claim might be denied or terminated. Number 1, you or your loved one don't need the long-term care benefits because you can perform basic activities of daily living. Number 2, while you or your loved one might have some impairment that impacts the ability to do basic activities of daily living, you don't have the right impairment and you don't have the number of activities of daily living that are impacted, or you don't have the type of problems that are required by the terms of the policy. So you just don't qualify. You may have promised, but it doesn't qualify based on the terms of the policy. Number 3, your PD hasn't progressed to the point where you need assistance with the activities of daily living. Number 4, you or your loved one haven't given us enough information to make a decision. Number 5, the facility that you picked isn't covered under the terms of the policy. Number 6, the providers who are providing the services aren't qualified, or those services aren't covered under the terms of the policy. Number 7, we'll get around to reimbursing you when we feel like it, or we need more information, and more information so that we can delay payment as long as we possibly can. Number 8, you or your loved one's PD has improved and you no longer need the care. And that's one of the key games that they will play. Number 9, you or your loved one has run out of benefits. Too bad, so sad. Number 10, the premium wasn't paid on time and the coverage has lapsed. Now, those are just 10 of the games that carriers will play, and they've got lots of tools in what I call the long-term carrier denial or termination toolbox. It's important that if you are facing a need to file a claim, that you consult with an experienced lawyer such as myself to review the policy and the medical records so that we can develop a strategic plan with the necessary medical evidence to basically win the claim right out of the box. And certainly if your claim is being denied or it's been terminated or they're playing the delay game, it's time to call me, 727-894-3188. In our next episode, I'm going to talk about what has to be done to win a long-term health care PD claim. See you in the next episode.